So, introduce yourself and give a little insight on your experience.
Okay. I'm Dr. Alfred Barnes. I have a private practice here in Norwich and one in Utica. And I used to be, I'm retired now, but I used to be the psychiatric examiner for the Office of Mental Health in Albany. But I treat a lot of the local patients around this area of New York now.
Where can I learn about types of mental health treatment in our area?
There are a number of places you can go. We have several private practitioners in Chenango County, and we also have the county mental health building where you can get counseling as well.
What are the different types of mental health professionals?
That's a good question. Obviously, we have psychiatrists. Those are the people who can prescribe medication on a medical basis. And then you have the psychologists and social workers. Psychologists usually do psychotherapy. Social workers usually focus on emergency needs and typical crisis calls. There are different disciplines within those practices, and varying psychologists will have different orientations. So you have to find one that fits what you need.
Where can I go for inpatient care?
That's a tough one around here. Right now we have the psychiatric facility down in Binghamton. It operates mostly on a crisis care setting. We don't have a lot of good services for emergency care inpatient in this area of New York right now.
Where can I go to find other local services?
There are a number of churches and schools. If you're a student, they'll have their own health services. There'll be a division of counseling services within those. You can get a lot of those campus issues dealt with through the school psychologist, whether it's a high school or a college. Otherwise, there are some churches around that offer their orientation for crisis management and counseling. They're all very good sources, and typically when you go there, if they can't meet your needs, they'll make a referral to the setting that's most fitting.
Where can I go if my insurance doesn't cover?
Well, that's a tough one. There are a lot of different insurance options right now. They're changing almost every day. But the best way to go in is to have an initial meeting with the people who do the screening in the psychology offices, and they'll set you up with whatever payment plans or insurance needs that you have. It would be hard to pay out of pocket, but some people do. A lot of times insurances through your employer will offer those benefits, but it's good to check around and call the offices ahead of time and see what insurance programs they accept.
Who would I be able to talk to if my psychiatrist wasn't available?
That's a good one. Whoever your psychiatrist or psychologist is, they need to have a hotline within their practice so that if there's a crisis, you get directed towards either their voicemail so that they can get back to you immediately, or to a crisis management team. But typically, if you can't reach someone for an emergency care, there are a number of hotlines that you can call. They'll be in the phone book, they're on the internet. They're usually 800 numbers. Sometimes you have to wait to get an available counselor, but you can find those services quite easily if you're in an emergency need. And again, calling 911, if it's a real emergency and you have a great deal of stress, they'll refer you to the hotline that's best fitted for you.
What can I do if my provider is not a good fit for me?
That's always a very good question. You'll know pretty quickly, and one of the parts of the intake is to see what your needs are and to see if that practitioner can cover those needs. And typically, when you do that first initial session, they'll talk about your presenting problem, they'll look at your background, and they'll have a plan, a treatment plan for you. And again, since you're the consumer, you're the one that has to be satisfied with that approach. Ask lots of questions. And if it doesn't fit, if it doesn't feel right, ask that practitioner for a referral. If that practitioner sees that this is a problem that's just outside of his clinical range, it's his ethical duty to refer you to somebody that can provide services for you.
What do you think could be done to make mental health care more affordable to the public?
That's a very good question. The problem with healthcare in the United States right now is it depends on what type of insurance you have and how wealthy you are if you don't have insurance. There really isn't a good option out of Medicare, Medi-Cal for those people who are disadvantaged and low income. But there are very few practitioners in our area that actually accept that. Ideally, when you look at the models that work the best, the public options are the best insurances. We in the United States are a long way from presenting that to our healthcare needs, but that would be a little bit better for the consumer to access any level of mental health care that they need.
In your line of work, do you feel that you're accessible to anyone who's in need of your services?
Actually, in my line of work right now, we have too few practitioners in our area. I am having to make, in my personal practice, I'm having to make referrals to other practitioners. And sometimes there's a waiting list to get in, but in our practice, yeah, we can provide services for almost any care.
Do you feel that Chenango County's lack of mental hygiene services is a contribution to a rise in poverty rates?
That's a good question. There's a lot of factors that contribute to the poverty level here. I think when I look at drug and alcohol treatment and how it's very difficult to get adequate treatment here in Chenango County, a lot of people either wind up in the criminal justice system or they move out of the area. A lot of people just exist with their alcohol and drug needs unmet. And that often does lead to poverty, loss of jobs, loss of opportunity, loss of housing, the homeless population. Yes, I think that there is a more wide-ranged mental health that we need in this county to address those needs. So yeah, I think there is a contribution to that.
What are your overall thoughts on healthcare in Chenango County?
We're struggling. Chenango County is kind of in a decline right now. It's difficult to get adequate medical care here, find a primary who can address your overall health needs. And I think that the options of public assistance for mental health needs is very, very narrow right now. It would be wonderful if we had more professionals that could move into the area and provide those types of services on many different